بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. My talk today about basic monitoring during primary care. The most important basic monitors during primary care include electrocardiogram, pulse oximetry, non-invasive blood pressure, respiratory monitoring, and body temperature. What is the importance of electrocardiogram? It is used as indication for the pulse rate, rhythm, and ischemic changes. Heart rate. A normal resting heart rate for adults range from 60 to 100 beats per minute. It can go up to 130 or 150 beats per minute or higher during exercise. Tachycardia. This means blood pressure more than 100 beats per minute. Bradycardia means heart rate less than 60. Normal rhythm. The rhythm of ECG can be normal or abnormal. Normal regular sinus rhythm as this photo picture for the normal sinus rhythm. Abnormal irregular rhythm, this is called arrhythmia. Arrhythmia means abnormal irregular rhythm. Shape of the ECG, it can be normal or abnormal, as in case of ischemic changes or premature ventricular. These photo pictures for ECG electrocardiogram. Above here we can see the PVC, premature ventricular contraction, normal beats, then premature ventricular contraction, or VF, this picture, and it can be coarse or fine. Coarse, this is good prognostic, or fine ventricular fibrillation, which is bad prognostic. This also photo picture for ECG, normal one here, normal ECG, abnormal here, no TB to no B wave, no T wave. In this site 3, there is abnormal also size of the ECG. Abnormal shape of ECG, size of the QRS complex was abnormal. This also a picture for normal ECG and another abnormal beat during which SCT segment elevated, this in case of Also another abnormality in ECG, it can be heart block. This is optional for dentistry students. Anybody want to have idea about heart block can look for this slide. This is the methods of measurement of non-invasive blood pressure. How to measure the non-invasive blood pressure? It can be measured through the inflatable cuff sphygmomanometry or oscillometric technique, or with finger plate thermography or external tonometry. Here about our students must know the use of sphygmomanometry and the measurement of the non-invasive blood pressure. Blood pressure, it is non-invasive blood pressure categorized as normal, elevated, or stage 1 or stage 2 high blood pressure. Normal blood pressure is, in this case, the systolic blood pressure less than or equal to 120 and the diastolic pressure less than 80. Elevated blood pressure when the systolic blood pressure between 120 to 129 and diastolic less than 80. Stage 1 high blood pressure in case of systolic blood pressure is 130 to 139 or diastolic blood pressure between 80 and 89. Stage 2 high blood pressure is when the systolic blood pressure is 140 or higher and the diastolic pressure is higher than equal to or higher than. The third monitor, the pulse oximetry. It is used for measurement of oxygen saturation. It gives idea about the patient good or well oxygenated or not. Normal oxygen saturation is above 92%. Patient is considered hypoxic when the saturation decreased below 9. Monitoring respiration, the respiratory rate measurement. Normally, the respiratory rate of healthy adults is between 12 to 20 breaths per minute. Normal respiratory rate for children as follows. At birth to 1 year, respiratory rate is between 30 to 60. In 1 to 3 years, it is from 24 to 40 breaths per minute. From 3 to 6 years, it is 22 to 34 breaths per minute. For 6 to 12 years, it will be 18 to 30 breaths per minute. From 12 years to 18 years, it can be 12 to 16 breaths. The last monitor in primary care, the body temperature monitoring. The average normal body temperature is generally accepted as 37 degrees centigrade. Some studies have shown that the normal body temperature can have a wide range from 36.1 degrees centigrade to 37.2 degrees centigrade. A temperature over 38 degrees centigrade most often means a fever and caused by an infection or other illness. Thank you.